On behalf of the Commission, I would like to welcome you and thank you for joining us today for today's launch. We hope that this will be the beginning of an important journey to improve the diagnosis and the outcome of people suffering from delirium. As you've already heard, it's not such an isolated event. I guess once upon a time, delirium was thought to be something that occurred in nursing homes or with elderly people, and there wasn't very much you could do about it other than to give them some form of sedative, so you really just kept them quiet without actually dealing with the underlying problems. You might say, well, what's the clinical care standard all about? Well, the clinical care standard is really nothing more in a way than a number of nationally agreed quality statements that describe the care health professionals and health services should be providing to patients for a specific clinical condition or defined part of a clinical pathway in the line of best evidence that's currently available. And I guess that's the other important thing. Nothing stands still in medicine. We are always looking for change, but the important thing, I think, is to evaluate that change so that it does become something that improves outcome rather than something that we think might be simply a good idea. So what will the clinical care standard do as far as benefit is concerned? Because obviously this does need to be beneficial. Well, as you've already heard from Sophie, delirium is probably much more common than many people might believe. And the other thing, of course, is that there seems to be fairly good evidence that's increasing. Now, this may not be due to an absolute increase, but just due to the fact that we are now more able to recognise, or perhaps even more willing to recognise delirium as a cause of major problems. But as you've heard, some 10% of Australians do suffer from delirium, and that increases quite markedly if they're unfortunate enough to be admitted to hospital. And it's not just the sick, frail and elderly that it's a problem to, because there's now very compelling evidence that if individuals who are considered fit for things like cardiac surgery or hip replacement or joint replacement are admitted to hospital, then up to 30% of those individuals can actually suffer from delirium during their time in hospital. So it's not that you've got people who are unfit. Presumably we're not doing cardiac surgery or orthopaedic surgery on individuals who are very frail and therefore not easily able to deal with the issues arising from their treatment. So you can see that this isn't by any means uncommon and certainly is often associated with admission to hospital for relatively routine procedures. And as you've already heard, then there's a whole list of things that seems to be associated with the diagnosis and the presence of delirium. There's increased mortality, more adverse events, and these are the sorts of issues I think we've seen for years, people falling out of bed, infections and pressure injuries. Now those things are going to create enormous problems for the recovery of those individuals that suffer from them, and it's been the delirium which has been the driver for those events to occur. And obviously when you get those complications in hospital, then of course there's going to be longer hospital stays, there's often going to be more unplanned readmissions to hospital, but I think sadly often this leads to earlier admission to residential care facilities, and this really does, I think, no matter how good the residential care facilities are, has a significant impact on the quality and the mobility of the life of those individuals that do end up having to be dealt with and looked after in a residential facility. The other issue, I guess, that we hope that this standard will improve is that delirium is often not detected, it's dismissed or misdiagnosed. And it's absolutely critical to be able to differentiate or distinguish delirium from dementia and to investigate it properly, as it may be the only sign of an acute underlying serious illness. So from that point of view, it's extremely important that it is detected and it is managed. And this, I think, is one of the things that we do need to understand, that often when a patient is diagnosed with delirium, it's so important to have been able to talk with their family, their relatives, to make sure we understood what they were like before they came into hospital, to make sure that this is a change, a significant change, and sometimes it's just put down as dementia and it's always been there, so let's not worry about it. So I think from that point of view, unless we do talk to the families, talk to their relatives and make sure that they're engaged all the time with what we're doing, we're not going to achieve the outcomes that I think we would like to do. The other thing, of course, is that we have to inform the community. We have established a fact sheet which we can provide to the consumers and clinicians and to help to support implementation, and also what we have got a set of indicators for health services to review the performance of their own organisation and to make improvements in the care they provide. And I think personally this is one of the great weaknesses of our health system, is we do not measure our outcomes. We often don't know what the outcome of our treatment is. We feel it's good enough to have actually enacted the treatment, and let's assume we all do well and they get good results. But basically that's not always the case. And so we believe it's so important that if we're going to continue to improve the care of patients with delirium, we do need to have the ability to measure what is happening, to record it, and then to assess it and make sure that we look for where we're failing or falling down in our treatment so that we can continue to improvement. So assessment of our treatment, to my mind, is just so important. And so we are, hopefully today, on the beginning of a very important journey. But we could never have started this journey if it hadn't been for the support of the various groups that joined the Delirium Topic Working Group. And on behalf of the Commission, I thank each and every one of them and their associate organisations for the time and the effort they put into this. Because this is really about, I think, the families or the family of health professionals coming together, recognising there's a problem and spending countless hours trying to look at how we can overcome or improve the outcome of patients who are suffering from delirium. So today, thank you all for joining us. It's my pleasure, of course, today to launch the Delirium Clinical Care Standard. May it serve our community well. Thank you.